It is Health Diary. Thank you for making time. My name is Gladys Gachanja and we're coming to you from the 4 Points by Sheraton here in Hallingham. Now, a brain tumor diagnosis can be a shocker to anyone, especially when you think about how delicate the brain is and, of course, the numerous functions it has. But the good news is that technology has advanced treatment options, giving hope and, of course, improving the quality of life of patients way after the diagnosis. So today we hear from survivors and also understand the science behind brain tumors, starting off with this fact of the matter. A brain tumor is a mass or growth of abnormal cells in your brain. Some brain tumors are non-cancerous and some brain tumors are cancerous. Brain tumors are among the most common cancers in children between 0 and 14 years. The risk for most types of brain tumors increases with age, though there are varied causes. The symptoms for brain tumors mimic other conditions, increasing the chances of delayed diagnosis.
Mtihani wa mwisho ndio atoke college, ndio alitupigia simu, macho yake haioni.
Niko na macho yangu imekuwa mbaya sana. Ile mbaya tena, kichwa inaniuma daily. Ilikuwa inabidi tu nimeze dawa like every time, don't feel poa. Nilikuwa naandika mpaka naona nimepotea laini nikaa mbili. Unajua sioni kabisa. Nilikuwa nimelose like 60% of my sight.
Kukuja nyumbani tukampeleka Kikuyu hospital. Sasa wakatutuma German hospital. Akapigwa hiyo picha, akaonekana akona growth kichwa.
Sasa kwanza kitu ya kwanza ilikuja mimi nilikuja ni cancer. Na mimi najuaga cancer mazee, cancer ni ngori. Lakini akaniambia iko treatable, ni kitu treatable yani. Hiyo ni kitu ndogo, growth. Sasa my mama hata ndo alikuwa anipea moyo.
Nikauliza daktari, akifanya operation ataendaje? Daktari akaniambia, mama, sitakwambia kitu, hapa ni Mungu, unaweza. Tukifanya kazi, Mungu ingine ana. Sasa kutoka operation, tulienda huko radiotherapy, akamaliza, na sasa ako poa. Ile iko, saa ingine akilala, hajijui. Hata tukimuita hawezi akaitika, anakaa kama nusu saa hivi, sasa akaamka. Sijui hiyo shida kama ilitoka kwa operation, hakukuwa na shida hiyo mbeleni.
Hata saa hii naweza fanya kitu dakika, lakini si dakika, masaa ama siku. Nasahau. Saa zingine nimechukua kitu kwa mtu saa fulani, nimeshasahau.
Tulikuwa tunatumia NHIF na ukifanya radiotherapy, lakini operation ni pesa tuliitishwa 1500. Na watu wakatusangia, watu wa kanisa, hata ninawashukuru sana.
Na mimi nawaambia wasiogope, waende surgery. Surgery inasaidia. Na kama si surgery kuna kina radiotherapy, kuna chemo, vitu mingi ziko.
So what is the science behind brain tumors? Let's find out. And to help us along with this conversation, Dr. Tracy John, who is a neurosurgeon, and we have Emily Nyanjui, who is a brain tumor survivor. Ladies, thank you for joining us. And I'll start off with you, Dr. Going by the textbook definition of brain tumors, what causes this mass or growth of abnormal cells in your brain?
The definitive cause or the actual cause, just like for other abnormal growths elsewhere in the body, the causes are not known. However, we have what we call risk factors. We look at things like genetic factors, excessive exposure to certain chemicals, other things like infections. Some viruses may predispose to these changes in the cells.
So what do the tumors do to the brain to make it malfunction, so to speak?
So when there is a tumor or this abnormal growth inside that small space, the first thing that is going to happen is that you're going to have pressure because you have introduced something new that is occupying the already tight space. So there's pressure inside that brain. Other than causing the pressure, depending on where that abnormal growth is taking place, because it can grow in different parts of the brain, this will depend on what is the purpose or what is the function of that part of the brain. So that now the cells which are there, the normal cells in that particular part of the brain, their function is going to be altered.
Emily, when were you diagnosed?
I was diagnosed June 15th, 2020.
Last year?
That is last year.
Okay, and what brought about the diagnosis? What symptoms did you have?
I used to have migraines, constant ones. They used to come in and out. Then after a while, I started fainting. Then my right leg stopped functioning very well. When I'm driving, I become numb. Then on this particular day, on the 15th, I fell. Then I could not walk. I could not do anything.
So then, when you say fall, you passed out?
I passed out.
Yes.
Yes. Then I was taken to hospital. When I was taken to hospital, I was done a CT scan. Then that's the time they discovered I have a tumor.
Where exactly was it?
It was on the right side here, this side.
Okay.
Yes. All
right, Dr. She mentioned some of the symptoms, especially the migraines. I hear that a lot. Which others are associated to brain tumors?
The way they present, or what you call the manifestations or the signs and symptoms, are very varied. The spectrum is very broad compared to other diseases elsewhere in the body. But the commonest one is headache. So the patient is going to start experiencing different types of headaches. So when headache is persistent, where we are looking at a headache that is been there for more than a month, we're thinking the person needs to be checked and to rule out the presence of a brain tumor. We have the presence of vomiting, nausea and vomiting. Then we have other manifestations like loss of function. And now the loss of function, as she has alluded to, depends on where the tumor is located.
All right, and when you were getting these symptoms before the diagnosis, what did you think they were? What were they saying in hospital?
Every time I went, I was told I have an issue with my blood, but no one told me it's all about tumor or anything. I was only given medication for infections, blood loss, because I used to lose a lot of blood. Every time my blood used to go down.
Why?
They never told me why. I was always given medication.
So you are anemic?
Yes.
All right. Yes. Did it reflect perhaps on your menstrual cycle?
Yes, it did, because I used to get from the first day of the month to the last day of the month.
Oh.
It was a constant one. And the flow was very big.
Okay.
Yes.
Okay, clearly those are telltale signs, but then again, they could mimic other conditions.
Actually, that is the main challenge when it comes to diagnosis of brain tumors. When you have a disease that is generally presenting with a very varied presentation, we have a spectrum of up to 30 signs and symptoms. That means because these signs and symptoms are not going to be all in one person, yeah, but these signs and symptoms also manifest in other diseases. So for instance, headache is the commonest sign of a brain tumor. However, there are very many other diseases that are going to make a person develop headaches. There are many ways we can tackle that, so that when we have a patient presenting with these signs and symptoms, as much as we are looking at other diseases, we also want us as health workers to be having the thought that it could be a brain tumor high on the list, so that we are able to do the test that we require, which is now the imaging, the CT scan or the MRI of the brain, early enough.
Was yours benign?
Yes, it was.
Okay. And what did they say it was affecting?
It mostly affected my eyesight and my functioning. I could not do anything. I became paralytic. My left side died, so I had to be operated.
This was after diagnosis?
Yes, after. They said if I don't get an operation within 11 days, I will not survive because it had gone too far. It had slept on. It was 7 centimeters, as they tell me.
Daktari, explain to us when we talk about primary and secondary brain tumors.
Primary are the ones that will have started in the brain, and then secondary will be looking at tumors that have come from elsewhere in the body and have metastasized to the brain. Then that will be a secondary tumor because it did not start there. The other ways is about classifying them according to the cells that are involved. We have tumors that transform. We have others that don't transform. So you may have a tumor that grows as a grade 1 tumor, yes, and it may grow to grade 2 or grade 3 or grade 4, while there are other types which will just be a grade 4 tumor from the word go, and it will remain a grade 4 tumor. So because of that progression and variation of the different types, then the terminology of grading helps us to be able to manage, determine the management options, and also to determine the prognosis and the severity of the disease.
Now, Emily, Daktari mentioned the risk factors that put people at crossroads with the brain tumors. Have you ever had this in your family?
First, it came like a shock because nobody in our family has ever had tumor of the brain. We don't even actually even hear the words like neurosurgeon.
For the first time. Yeah.
I didn't even know there was such a thing. So yeah, it was challenging, but at least they accepted me and they took me through because every person in our family was involved. My uncles, my aunties, my mom. Yeah.
Daktari, are brain tumors common?
Brain tumors are pretty common. That is worldwide. And actually, what has happened over time is that we have an upsurge of cancers worldwide. There is an increase that has been noted in the last few years, and it's been noted to keep increasing. That said, brain tumors have not been left behind. They're also following that spectrum. That has showed that brain tumors, every single day we have about 500 people who are diagnosed with brain tumors worldwide. Yes, and locally you're looking at about 6 persons being diagnosed every day. And that is not obsolete because we also have what we are calling late diagnosis, what we are calling challenges with diagnostic equipment, so that we could have others who have not yet been picked because of availability of diagnostic equipment, and also the awareness. Yes.
Okay, and we'll definitely talk more about that in a moment. And also, when we come back from the break, understand the importance and the role of psychosocial support for brain tumor patients. We'll be back. Thank you for staying with Health Diary. My name is Gladys Gachanja. Still having that conversation on brain tumors. We still have Emily Nyanjui, who is a brain tumor survivor, and of course, Dr. Tracy John, who is a neurosurgeon. And ladies, before we went to break, I mentioned the importance of psychosocial support when it comes to brain tumor patients. And Emily, you mentioned when you were given this diagnosis, it was a shocker. Did you undergo any counseling before all these things happened, or did it come after?
Everything happened after. Before it was just a normal disease. I thought it was just a headache. Yes.
Okay, and when you woke and they did the counseling, what were you being prepared for?
First, I was prepared that I might lose my memory. I might never remember anything, which happened for like 10 days, but later on it came back. I might never walk. Like I was told by my doctor, Dr. Magoha, I might take 7 months without walking well. I might lose my vision, which is still there because I'm still not seeing very well. I'm seeing partially. So they told me a couple of things will happen. So it was good because if they didn't tell me then, I thought I'll just wake up and just be the normal Emily as I was before.
When you woke up, did they tell you if they removed all of the tumor or just partial of it?
I was told by my doctor they removed it all. I was even shown a video of the operation. And then later on I was given, I was even shown the sample of what was removed from my head. Yes.
How big was it?
It was 7 centimeters.
Wow, that's huge. Okay, and did you ask if there is a chance of recurrence?
I asked and I was told after 3 months, 3 months later I had to do an MRI again, which showed that I had nothing on my head again.
So we're good. Yes. All right, that is great news and very encouraging. Daktari, apart from surgery, which seems to be the most common option for brain tumor treatment, what else is there?
We have other modalities of treatment like the use of chemotherapy. These are medications that a patient is given. We have radiotherapy. This is where somebody is put in a machine and we use radiation to sort of tackle this tumor. Radiosurgery, where the tumors that may not be accessible through surgery and they don't respond to, say, chemotherapy, then you're going to attack that tumor with the high frequency radiation. What determines what type of treatment you're going to instill on a patient will be determined by several factors, including the type of tumor they have, where it is, the grade of the tumor, has it recurred or is it the initial type? Yes, all that will determine.
We have mentioned the possibility of recurrence. What informs this?
One of the factors is the type of tumor. There are some types of tumors that have much higher chances of recurring. Yeah. Two, we have the grade of the tumor. The higher the grade of the tumor, because they are graded from grade 1 to grade 4, the higher the chance of it recurring. We have the location of the tumor, because again there are areas in the brain that are very deep-seated, very sensitive, very eloquent. So even in terms of if you're going to undertake surgery, the amount of surgical excision that can be done can be limited by the location of that tumor.
Okay.
Yes.
All right. Now, some patients get a diagnosis but are told nothing can be done as the tumor puts them at risk. Like it needs to be left alone because going for it could actually put the patient at more risk. Explain.
Sometimes a patient may present when the tumor has really affected the body so much that either by local effects where the tumor is growing, maybe it has grown so much, it has involved so many parts of the brain in terms of functionality, pressure effects, or with time, just like other tumors elsewhere in the body, it wears off the general body performance. So the patient may be too sick. So that you're looking at, if you take that patient to surgery, you are not going to be able to get that patient the body will not be able to withstand the aggressive treatment that you may want to offer. So sometimes, depending on that and also how the tumor has progressed, sometimes the tumor has recurred, it's a grade 4 tumor, you've done the best, you have reached the maximum end of the treatment. So in that sense of aggressive treatment, then you can say now we cannot do aggressive treatment anymore, but there's always something we do for the patient.
All right. And speaking of complications, as you said, your eyesight was affected. As you had been told, your mobility also was affected. What did you undergo? What's the aftercare that you were given?
First I was put under medication for like 7 months, constant. Then I had to go for physiotherapy because it only one of my side, the left side, could not function. Then again, I had to see an optician. I always go for frequent till now, see my eyesight because I lost it. One of the right side cannot see till now. The left can see very well.
So let's talk about the cost of treatment, because this is where it gets really tricky for some people. How did you cover this?
I had a medical cover. Then most of the funds came from my mom and family. That's why I got the money. And
So-
NHIF.
Aha.
NHIF came along.
Okay.
Yes.
Dr. a lot of patients opt to travel outside the country to get interventions for brain tumors. Is it because it's not affordable in this country, or we do not have enough specialists?
One of the main challenges we have is the availability of the human resource for health. The country right now, we have about 40 neurosurgeons against a population of about 50 million people. It's not just about neurosurgeons. We have oncologists, we have neuroradiologists, we have the neurointensive care specialists, we have the nurses, we have the whole team that comes on board to take care of these patients. We have shortages. We have the equipments. Right now we have 2 centers in the country which are able to deal with these brain tumors. That is one at the Kenyatta National Hospital and another one at the Moi Teaching and Referral Hospital in Eldoret. You need ICUs that are working, because one of the unique characteristics of brain tumor management is that ICU goes hand in hand with surgeries for brain tumors. You need to relax the brain after surgery. In terms of financing, we need to allocate more money to be able to take care of the patients. When you have patients who are mainly paying out of pocket, it becomes a very big challenge. You have to do a fundraising, and people have to sell their property. So in essence, it's actually increasing poverty in the country. So we would like to see this funding, financing, expansion of the neurosurgical centers, training and maintaining and distribution of the human resource for health, for brain tumors. We want to see awareness, creation of awareness, because again, we need health workers to be more aware about the presence of brain tumors, so that we can pick them earlier and think about them earlier. Awareness in the population, so that our patients are also able to improve their health-seeking behavior towards improving in the early diagnosis.
You've come a long way from diagnosis, showing that there is life after a diagnosis with a brain tumor. However, you suffered from post-healing depression. Tell us more.
I could not accept that life has changed. Then I cannot see as I used to see. Right now I'm dependent on people. Like, I cannot drive, I cannot take myself to a supermarket. I cannot do so much for my son. I cannot, right now I've been banned to cook till at least 2 years down the line. After every 6 months I have to go for an MRI. So there's a change in my life. After every 3 months I have to see an optician because of my eyes. So it's not something that is awesome. You cannot accept it like that. So it's depressing on one side, yeah. Okay. But at least I'm trying to deal with it day by day.
Okay. And what would you encourage others on this same journey?
First of all, I would tell people, as an adult, having headaches more than 4 or 5 days, I think you should seek the right, you should go to see a specialist upon it. Get these scans. Like me, I didn't know there's something called like a CT scan or MRI. Those are words I had afterwards. I think wrong diagnostic is something that is killing people out there. Because every time my doctor, Dr. Magoha, tells me, if I got the right treatment from the word go, if I did that CT scan, at the moment my headache started, I could not have gone through operation. Because operations, yes, you get well, but there's so much in your life has to change.
I think it's important to encourage those that find themselves on this path. As a specialist, what would you say?
It's not a hopeless situation. There is support. There is modalities of treatment. There are modalities of diagnosis in this country. We have teams that are working day and night to make sure that these tumors are not only managed well, but they are also picked early, because being picked early is one of the ways that is going to influence the outcome and also the treatment. It is a journey, but we've already started the journey. We are heading in that right direction, and there's a lot of work actually that is going on. It may not be quite obvious, but there's a lot, and people are doing a lot. We have different professional groups, different associations, different public groups that are looking into that, and everyone is, I would say, a lot of people are playing their parts, and eventually when we all unite and see how to move this vehicle in that right direction, we support the systems, we support each other, we are going to be able to sort of get hold of the brain tumors.
All right, Dr. Tracy John, neurosurgeon, and of course, Emily Nyanjui, who is a brain tumor survivor. Thank you for joining us on this conversation. And at this point, we take the health tip.
Spectacles, you usually, most optometrists, where you buy the glasses, they'll give you a cleaning solution. But even just water and soap is good enough. Preferably not detergent, the Omos or the Entos. No, just normal soap, bar soap is good enough if they're oily. What you shouldn't use is alcohol-based. The important thing is the cloth. It should be a lint-free cloth. Otherwise, it will scratch. When you put them down with the glass looking up. The other thing about glasses is when you put them on, hold both frames. To put them on and to put them. There's this habit of grabbing one, and generally over time that becomes loose or it bends, or this other one, because now it's coming out and anchoring on one, so it will tend to damage one. So remove with both hands, put them with both hands.
Another informative episode of Health Diary. Remember, for any of your questions or comments, you can always reach us on our social media handles. My name is Gladys Gachanja, and we've been coming to you from the 4 Points by Sheraton here in Hallingham. Until next time, see you. Now, a brain tumor diagnosis can throw off anyone because good news is that munatembea sana, munani distract. Remember, for any of your comments or hiyo ni kizungu gani jameni? Haya. Remember, for any of your comments or questions that wacha kucheka. And we're done. Yeah, thank you for your time.